Hello, everyone. A warm welcome to today's webinar, which is going to be quite revolutionary as far as care of our patients is concerned. I would like to thank Indian Chess Society for being our academic partners and for always making sure that week after week, every Wednesday, we have the best webinars which help us improve our clinical practice. And I would therefore want to thank the entire governing council of Indian Chess Society for their commitment. I'm extremely happy that we are going to be talking today about revolutionary stuff like using digital technology in improving patient care because I am looking forward to learning a lot myself because I'm not very good at this. And I'm sure the very eminent and distinguished faculty that we have is going to teach us so much that we're going to be much more learned and much more enlightened at the end of this webinar. So now let's get going. I would like to just introduce the topic first. So the topic is very exciting. It's take it easy. It's all about digital innovations in lung health management. And you all know me. I'm Dr. Amita Nene. I'm going to be your host, the moderator for today. The discussion cascade is going to be something like this. So in today's meeting, we are going to do something different. We are going to define the various topics which are important and the gaps, and then our eminent speakers are going to address each of these problems and they're going to give us digital solutions for this. And therefore, I think it's going to be extremely important. So let's basically, first we'll have the definition of topics followed by our introduction of speakers. So let's focus on some key questions today. So we are going to be discussing what is most important. Should we chest physicians continue to practice the way we have been practicing? Is the world around us changing? Are these global patterns emerging which we should not ignore? And does digital technology have a role to play? And I'm sure each of us have the same questions which we want to know the answers to. And at the end of the webinar, we are going to know everything that is going to help us change our practice, help us improve our practice, and be updated with the current knowledge. So we have leading voices in respiratory health enlightening us. I just happen to be the moderator, but we have our international speaker, Dr. Professor Paul Jones. We have our very own Dr. Prabhu Desai. We are so extremely fond of and proud of him. And we have a young pulmonologist who is also a digitalist. We have Dr. Mehul Thakkar. So I'd like to first invite Dr. Prabhu Desai to give us his talk. Dr. Prabhu Desai requires no introduction whatsoever. We know he's a consulting chest physician and he's head of the department at Lilavati Hospital Respiratory Department. He has been a fantastic bronchoscopist, whether it is diagnostic bronchoscopy or therapeutic. He has been a master and he has special interest in also managing MDR TB. He has got hundreds of publications. He's a teacher for DNB respiratory medicine, and he is truly a teacher whose commitment is only to teach. So over it to you, Dr. Prabhu Desai. We look forward to listening to you.
Thank you. Can you hear me?
Yes.
Thank you, Amita. Thank you, Indian Chess Society, and thank you, Nandita. Today's the topic is little different. My topic is patients compliance in respiratory therapy, the gaps and the way to reduce it. And so we all know that if the patient is not compliant, then what happens? Okay, so he has got basically his quality life gets affected. He has got high morbidity and of course mortality. And we have here taken 5 diseases which are very practical and very common in our practice: asthma, COPD, pulmonary tuberculosis, and obstructive sleep apnea. These 5 diseases, you can say, okay, need a very important is their compliance is a problem. Okay, and that leads to a lot of issues in asthma management, similarly in TB, and in of course in OSA as well. So as well as airway disease are concerned, okay, we know that there is always an over perception that my asthma is well controlled. I'm taking regular medication and I don't need a higher dose, or there are side effects which probably also responsible to understand about the perception of the symptoms. And there is also under perception of the symptoms. Take less medication, inflammation persists and symptom worsen, and that affect directly the overall the cost of management becomes high because of the high morbidity and mortality happens. The appropriate perception leads to a proper medication and good medication and adherence to therapy. So obviously we know that what over perception and under perception leads to, and this happens in every disease. Say for example, in asthma, this is very obvious that almost 82% of the patient perceive their symptoms as less severe. Okay, and the really fact is that not only the patient but even the healthcare provider also's perception about asthma control of the patient is not really appropriate when we consider asthma control tests. Okay, so the perception of uncontrolled asthma is very high, and perception of non-serious asthma is also there, and also the almost 95.4% of the perceivers of asthma is partially or controlled asthma, and 75% say as non-serious asthma. So the asthma point of view, the patient perception is, if patient perception of uncontrolled asthma but the controlled ACT test, if we see that white area over here, so it is lesser, but it is still there. And the patient's perception of controlled asthma but uncontrolled ACT is significantly high in all steps of asthma. Step 1, step 2, step 3, step 4, and total perception is also, you can say that's many times wrong. So the challenges over here is that the asthma education is very important, and it is more important than even therapy. But remember that education, once you educate a patient, is not sufficient, and patient needs a constant education and they have to be constantly being educated about the disease also, and their control also, and the medications how they take, whether they're taking correct inhaler therapy or not, whether they follow properly the technique to reduce the side effects of medicine or not. So this is constantly required. um, the inhaler techniques, especially when the patient asthma gets controlled very well, they do not continue the medication. That's a major problem. Keeping the adherence to therapy is a challenge in asthma, especially when patient is asymptomatic. Similarly, in COPD, in fact, 30% of the COPD patients are found to be adherent to their uh, prescription, and there are more complexities than even asthma, because their inhalers, they have frequently changed their methodology of inhaler therapy, whether it's a dry powder or meter dose inhaler, is they always change the dosages. They don't follow, they over treat, sometimes under treat as well. And so the skills where how they use the medication also needs to be constantly observed, and they develop a lot of side effects because of the overuse of medication, especially the systemic side effects of inhalers are very common. So obviously almost 40 to 60% of the patient adhere to their prescribed regimen, and 10% of the patient with the meter dose inhaler perform all essential steps to take it correctly. Highlighting the essential role of education and inhaler technique is so important in COPD management. TB, we are all aware that how the compliance matters. The compliance is affected because of long duration of therapy, and that leads to frequent defaults. Then the combination medication, so patient have to take all medication to take together, and if they are not taking it properly, then obviously resistance develops, and that's a major issue. The result of poor compliance is development of resistance, spread of the disease to the patient's family member and also into the society. The reason for the defaults or poor compliance is also because of unpleasant side effects of medicine, and for that it's constant advice, a constant education is required, and a reassurance required to them regarding the side effects of the medicine. In OSA, the sleep apnea syndrome, which is so important to prevent cardiovascular events in a young person who has got a moderate severe sleep apnea, and also if they have other comorbidities like diabetes, hypertension, ischemic heart disease, cardiac failure. So these all basically diseases with sleep apnea. They have to patient has to follow the CPAP therapy properly and regularly. So this is the great major issue, because almost 50 to 60% of the patient they are not compliant in sleep apnea. They buy the machine, they buy the mask, they start using it. After some time, they stop using it, and even there is no methodology basically to follow up them, because they just lost. Okay, so if there is a system which can improve the compliance, especially in sleep apnea, and then they will stick to the medication, and lot of other diseases which require to be controlled, like diabetes and blood pressure and cardiac disease, will be well controlled if the sleep apneic patient remain compliant. Currently they are not really. So the compliance leads to number of admissions, morbidity, and of course death. It leads to increased cost to the patient. So loss of compliance to the patient is really not good. And the compliance can be improved by educating the patient. But I told you just now that constant education is required, but just mere education is not required, but there should be a structured physical led support program, such as disease management program or a chronic care program is required. And that will really improve the compliance. And many times, by talking to the patient is not required. We should have some platforms where we can have we can improve the compliance. The patient's alerts are an effective way of improving adherence to controlled medication in asthma patient. This has been proved beyond doubts that compared to usual care, and patient's adherent coaching and patient alerts give rise to a significant amount of adherence, and patient's alerts with adherence coaching gives you further improvement in the adherence program. So the giving by technology the alerts to the patient regarding the medication is very important. And there is beyond doubt that in asthma, okay, and the compliance, the adherence improves significantly compared to the other way we try to make the patient compliant. So this is how the difference is very great. And digital technology by in teaching the patient asthma alert training program, asthma patient alerts to take the medicines, and adherence to remind the tools is very important, and that can improve the asthma medications to be taken properly. Same with the COPD, there are various other methodology which can help the COPD patient to with the digitally to be compliant and get trained properly, and also understand the side effects of medicine, how to reduce the side effects of medicine. So recognizing signs, symptoms of exacerbation can be done by the digital platform. Inhaled training can be taught, and this can be constant. So even small things can be found out. In fact, how to take care of spacer devices, how to gargle, all those things can be taken care very well frequently by the platforms, and that helps to adherence monitoring. Effect of digital in sleep apnea is now also proven very well. There are methodologies by which we can find out whether the patient is using the CPAP regularly or not, at least 4 hours in the night. And that also we can also find out by the card reading of the patient, what are the problems the patient face, like especially whether the leak is there, or whether the mask is fitting is not proper, and that leads to hypopnea index increasing, whether the patient get central apneas or not. All those things can be found out. And if the patient follows up because of the symptoms not getting relieved, we can always correct them by understanding their compliance on digitally. So this is how the sleepiness test tool and the sleep monitoring patterns and the other patterns can be monitored digitally. So for TB point of view, okay, the adherence to TB treatment is very important. Government is trying to make it more systematically by even including some digital platform to improve the adherence. But if we have a very effective platform, then the TB treatment can be really, patient can be really compliant, and we can decrease the MDR tuberculosis or even the spread of tuberculosis in the community. The key aspects of TB care monitoring will be side effects monitoring and video observed therapy in for TB adherence. And I think those something will be discussed later on in the following talks. Symptom profile also can be monitored. So my conclusion is that strengthening the health literacy so that patient understand the importance of regular medication and intake can be best done digitally. And structured physician-led support programs such as disease management program or a chronic care management nowadays we just cannot be just by talking to the patient or in the OPD, but absolutely best done by digital monitoring. So digital technology intervention can play a strong supportive role in the management of chronic respiratory diseases and which can improve the health of our patients. Thank you.
Thank you so much, Dr. Prabhudesai. This was a fantastic talk. And I feel that, whether it is TB, COPD, asthma, obstructive sleep apnea, this makes actually almost 85% of our OPD practice. And therefore, we are going to be able to improve compliance of patients, which is huge problem in the overall outcome of the patients. Then I think this is going to be definitely extremely revolutionary. Thank you so much for this brilliant talk, Dr. Prabhudesai. It was really a fantastic talk.
Thank you, Amita.
So basically, Dr. Prabhudesai has very nicely told us that there are certain gaps when we talk about patients, and the biggest problem about the gap in the outcome of the patient is compliance to therapy, which is a huge issue. And we've actually found out in what way we can actually improve the compliance. However, there's a different problem about the patients, which is lack of longitudinal data, which may not be available every time with all the patients. And at the same time, if we talk about doctor related problems, then sometimes we just realize that between we seeing the patient and the first time and seeing the patient the second time, there's absolutely no connect. We just don't know what's going on with the patient between he sees us the first time and sees us the second time. And while we are with the patient, often we don't have that much time to really find out everything that might have actually happened. And therefore, it's very, very important to introspect that in spite we having a doctor support system like an educator or a nurse, compliance to treatment still remains an issue. We have been providing counseling to patients. However, we see that there is a gap and we definitely need to do something more. Electronic medical reports is giving us data, but for longitudinal data, we need to motivate the patient to generate data, especially when these are remotely accessible. And it is time to switch to support system to the patient. And will this help us better manage our patients? So it's very, very important. The patient issue, compliance to therapy, very nicely Dr. Prabhudesai has told us. Now I'd like to invite Dr. Paul Jones, the master himself, who's going to tell us about doctor-related issue, which are patient-specific data, if available over time, can be of huge help or not. And now I'd like to invite our international speaker, none other than Professor Paul Jones, who really requires no introduction whatsoever. He is a key opinion leader in the field of respiratory health. We all know that. He has developed the SCRQ, the St. George's Respiratory Questionnaire, which we all have actually learned about and we keep on referring to. And most important, in the gold guidelines, the CAT score, the COPD assessment test, and the exact exacerbation diary card. All these are actually invented by Sir Paul Jones, and we absolutely admire you and we are in awe of you. Currently he's researching effect of COPD in cognitive function. He's on the editorial board of the CHEST. He's the associate editor of Journal of COPD, and he is the member of Gold Science Committee. Over to you, Dr. Paul Jones. We are really looking forward to you enlightening us.
Yeah. Let me just share. Oh, sorry. Bring my screen over here. Can you see my screen?
Only partially.
Only partially. Okay. I better correct that. Okay. Is that better?
Yes, perfect.
Great, thank you very much. Thank you for that introduction. Yeah, I'm not as great as you make me sound, but the other correction is that I'm actually no longer a member of Gold, but I was for about 10 years. And it's a great pleasure to be talking about this topic today because it's looking to the future. Now, there was an excellent review article written very recently that is very blue sky thinking, talking about all the wonderful things that digital health might offer us. And I'm not going to talk about it in detail, but I'll talk a bit about what the future might hold, but then start thinking about what actually practically today it might be able to do for us. So, as you've heard already, we have inadequate data collection in asthma between doctor visits. The problem is that in chronic disease, we often only see the patient every few months, or in the case of the UK, maybe only once a year. So we have very partial idea of what's happening to the patient. We've got inadequate data, so we can't properly evaluate the patient's condition between their visits. We rely on their recall, which, as we know, may not be very accurate. And the other thing is, as you heard, we don't know their status of compliance with their treatment. And the end result is going to be poor asthma control and frequent or likelihood of more frequent exacerbations. So currently, across the world, in current practice, we've got little individualized data collection or integration. It means our data is static. It's only relevant for the day when the patient visits the doctor. But in clinical practice, the problem is that we don't aggregate our data very well. It's not a priority. Longitudinal data points are captured in very few clinics. I know almost nobody who actually plots out their patients' investigations or their results over a period of time. In hospitals, it's better. We have electronic health records, and sometimes actually these plot out results. You can plot the biochemistry results over time, for example, but that's not really used at all in chronic disease management in the community. So I'd like to introduce you to a concept called patient-generated health data, or PGHD, which I think is going to be part of the future of healthcare in chronic disease management. And you can see the cogwheel picture there. We have the patient, the doctor, but the key new development is digital or partnership with digital platforms. And that's got advantage for the patients in terms of empowerment. It allows the patient to play a more active role in their health management than they do at the moment. And also it will personalize it because more comprehensive data means more personalized data. And for healthcare professionals, it provides a more holistic view because it complements the clinical data, providing a more comprehensive picture of the patient's state. It will improve monitoring to track the patient's health status in real time and allowing more timely interventions. And of course, I hope at least it will foster engagement with the patient to result in better communication between the patients and the providers. And it's very interesting on that point. You heard the cat mentioned earlier, and when we developed a cat, we wanted something that would foster communication between physician and patient using a common concept, a common number. And now, in fact, the cat's been developed very nicely as a measurement tool to monitor the patients. I'll come back to that. So I would argue, and that last article argues that there is significant potential if the patient or physicians have adequate real-time data on their patients. And that's where digital technology comes in, because it can enable regular collection of health data. Ideally, it would not involve the patient at all, using wearable devices, so the patient doesn't have to key in any data. But in terms of the patient's symptoms, only the patient can tell us about that. So we have to rely on the patient completing diary card data, but other things such as digitally equipped inhalers to know how often the patients are using their inhalers, that doesn't require patient cooperation. And to me, the really important development is that different kinds of data can be combined to create a composite picture to inform the patient's decisions. Okay, so here is a case taken from that Lancet article. I think it's slightly idealized at the moment, but it shows where we can be going. So this is a lady who's got a 20-year history of difficult to control asthma. She's had recurrent hospital admissions, but most of her medical care is now delivered virtually via telephone or video consultations. Between the routine appointments, the pulmonologist can monitor her rescue inhaler use through a connected digital inhaler. But she also, we can also monitor pollution levels or pollen counts. And she and her pulmonologist observed that a recent rescue inhaler use occurred during periods of poor air quality. And so combining these different types of information could lead the physician to change her maintenance inhaler treatment with a consequent improvement in her symptoms and a reduction in her rescue medication use. And this is how each of these data points could help in personalized disease management. You've seen some screenshots of a actual existing tool that's now available, and these are idealized screenshots that are taken from that publication, showing how each of these data points can help personalized disease management. On a single screen, we can show air quality, rescue medication use, and integrate that data into a more comprehensive picture. So this is the future. New systems of personalized care supported by longitudinal data points. And these have to be built around a range of different technologies. But the key one, I suspect, in asthma and COPD and in other respiratory conditions will depend on the patient providing data about their symptom level. But we can integrate that data, and that can be supported by continuous connectivity or reminders to the patient to complete a questionnaire. And as you've heard, they can also provide on-demand educational content. In fact, you heard, if you look carefully on one of the previous screenshots, the search was mentioned. That's a COPD exacerbation recognition tool developed to advise the patient or what to look for when they get worse and seek medical attention. And that application on a digital platform is really the key forward. Rather than giving the patient a piece of paper to remind themselves around an action plan, whether for asthma or COPD, having a digital tool with direct connectivity is going to be a significant development. So I'd argue that there are changing roles for clinicians and patients. At an individual level, continuous measurement will allow comparison of the patient's present state with their historical data, how they've changed, how they were in the past. And it can alert the patient and their HCP to the fact that the patient is moving out of their normal operating range. So let's come to a practical advantage example. Now, you've seen this slide before, in fact, but I think repetition is important in this case because it shows that patients and their physicians misjudge the level of control of asthma. So on the left-hand side, on the y-axis is the percentage of patients. In blue on the left-hand side is the percentage of patients who perceive their asthma to be well controlled. In the middle, in pink, is the physician's judgment of the patient's asthma control, the same patients, physicians judging their own patient's asthma control. You can see that the physicians were a bit better at judging control. They rated the number of patients with good control to be lower than the patients themselves. But on the right-hand side, there is a validated measure of asthma control, the ACT. And you can see that both patient and physician overestimate the level of control that the patient has. In fact, about half of the patients were under controlled. And here's another study relating the patient's perception of their asthma control relative to the GINA definition. And we see that nearly 84% of patients judged their asthma to be controlled, but in fact were uncontrolled using GINA criteria. And in the same study, we saw that 80% of patients who considered that their asthma was controlled had experienced one or more exacerbation in the previous 6 months. So we really need to measure and track our patient's level of control using an instrument such as the ACT. Now, this is a theoretical example that I put together, but to illustrate a couple of points. On the left is when the patient was seen 10 weeks ago, and on the right is when the patients were seen today, 10 weeks later. And on the y-axis, we've got the ACT score, and the score of 20 or more, as you know, indicates well-controlled asthma. So when the patient turns up at week 10, or when you first see the patient, they're well-controlled. When they turn up again at week 10, their ACT score is 20. So, okay, that's fine. They look controlled. But if we collect the data at intervals, we can see that there was a period when the ACT was lower, and we know that low ACT scores indicate a risk of exacerbation. So now at week 10, the physician can see the change in ACT score, ask the patient about what happened, and then make a decision, an informed decision, as to whether they should have their dose of ICS increased or not. This doesn't determine that they must have their ICS dose increased, but it gives the physician more information to make a better judgment. Now, here's an example of digital platforms that can offer a comprehensive disease management for asthma and COPD patients. And part of the development of this was linked to work with the COPD Foundation to apply the CAT, or in this case, the CAAT, to a digital platform. Now, you may know about the CAT. It was the COPD assessment test, but recently we have validated its use in asthma, and that's why we now call it the CAAT, but you can still call it CAT. And in fact, it's very likely that GINA is going to recommend the use of the CAAT in asthma management. And I'd just like to almost finish by showing you how this CAAT screen can look like on the Pinktree platform. And I should say that this implementation of the CAT on a digital platform has not been done anywhere else in the world yet. This is a world first. So to summarize, I think for chronic disease management, patient data is the way ahead. Respiratory therapy will change with the help of technology-driven individual patient data. Integrated data will become central to disease management in the future. And I'd suggest that countries or physician communities who understand and adapt to this change early will lead the world. Thank you very much for your attention.
Thank you, Professor Paul Jones. This was a fantastic talk. Very, very informative, and very, very happy to know how we can improvise in the lacunae that we currently have in our practice. And to hear it firsthand from somebody who has been the master of technology, perfectly using in his practice, we are honestly extremely grateful to you for this fantastic talk. I would also like to thank, actually, for this initiative. I would like to thank none other than Nandita Dandekar and Dr. Mrunmayee Toraskar, who both are a part of this Pink Tree app, who have invented this app, and they've been kind enough to enlighten us about this app. Uh, After this, I'd like to move to our third talk. I'd like to introduce none other than Dr. Mehul Thakkar, who's the youngest amongst us, but he is quite a rage as soon as respiratory medicine is being spoken about. He's extremely intelligent, absolutely brilliant. He's seriously tech savvy, and he is absolutely perfect in everything that he takes up. He is the consultant pulmonologist with the Medansh Hospital, Mumbai, and he's also working at the Jupiter Hospital. He has a huge experience of 15 years. Though he looks very young, he is quite senior. Special interest in bronchoscopy, thoracoscopy, and related procedures. And he's also worked in KEM, Sion Hospital, and DY Patil Hospital. And he is the treasurer of Indian Association for Bronchology. And believe me, the IAB would not have been working the way it is without the support of great Dr. Mehul Thakkar. And he's basically also a great digitalist. He knows how to use technology, and he's actually already incorporated this in his practice. So over to you, Mehul. We want to learn everything that you know and we don't know.
Thank you, ma'am. Thank you for such a kind introduction. And I thank ICS for giving me the opportunity to speak on this. One sec. So sharing my screen. Yeah, I hope it is visible.
Yes, we can see it.
Yeah. Yeah. So my talk is going to be about what technology is here to offer. And I can tell you, I've been handling EMRs since past now 12 years. I started using EMRs in the end of 2012. And I can tell you that it helps a lot. You get a lot of data saved with you when the patient comes next time. But there is always a gap. What happens in between those two visits? There's always a gap where the patient is taking the treatment properly, whether there was any fluctuations in patient's condition. And I always felt, even after developing, I had my own app which I was using for EMR. I still felt there's a gap somewhere and somebody should fulfill that. So I'm here to tell you what all we can do with the technology and the data. And as we all know, data is the new gold or the new currency. So let's use this currency for our patients' betterment. As we all know, India has a huge smartphone penetration, more than 800 million users, and openness to use the smartphones is seen with the penetration of UPI. We can see even the street vendors, the fruit market, everybody has an UPI, and even the economically challenged people carry a phone with a UPI app to get and send money. Mobile and internet penetration has become very huge. It has become a personal interface. People tend to get majority of their information from the internet, which sometimes can be misleading. And there are multiple applications. As there is an infrastructure ready, we just need something to come up and shape the way we handle our patients. There has been a clear focus even from the government of India. I am sure everybody knows about Ayushman Bharat Digital Mission. It is India's attempt to digitalize healthcare systems. I am already part of ABDM. I was a propellant for last 1 year. I worked with them. Everything, the pathology lab, the radiology department, the primary care physicians, the specialist, everybody can come on their own platforms, but something which can be integrated. So if I want to see what a surgeon has written, I can just go to the app and see what the surgeon has advised, what was the findings of the patient was presented with to the surgeon or to the orthopedic doctor. And this is something which is an ambitious project, but all of us have to somewhere down the line be part of ABDM. And India has unlocked the power of healthcare with technology to improve healthcare outcomes and access. And technology support is the way ahead. No matter what we say, people are going to visit YouTube to check whether your knowledge is correct, whether what you said was correct. They're going to go, when you say do physiotherapy, visit a physiotherapist, they will still go to YouTube and check what is diaphragmatic breathing, what you have written. So digital technology can be of immense help. And here we should use it to increase the compliance for therapy. A patient of diabetes is scared, knows when if I don't take my pill, if I don't take the insulin dose, I can land up in trouble. An asthmatic patient does not have that fear. But we can still monitor the patient if the compliance by using a digital platform. And most of the times, digital technology is used for video education. I'm sure many of my colleagues and obviously juniors use video education as a platform to send them on the use of inhalers, on the need for compliant of therapy, maybe some tips about side effects or diet by a video platform. So video education has shown better results due to, you can slowly and clearly explain in the educational video. It is not superior, but it is also not inferior to face-to-face education. It's just maybe a one-way thing. And it would be a way to reduce health literacy inequalities, and it will be a good catalyst for inhaler technique education where we all struggle. Even the patients who have been taking MDI with spacer, they get a little casual sometimes and just use the inhaler without the spacer, and then over a period of time land up with exacerbations. For tuberculosis, I think the future can be VOTs. Like we have DOTs developed by our government, we can have video observed therapy for tuberculosis, which can make sure there is an adherence. There is something called as 99 dots. We all know that there was, people have developed apps to make sure patients are taking treatment. The inhalers have sometimes Bluetooth in them. The CPAP machines have Wi-Fi and Bluetooth connections to make sure they get the data on the app, how much the patient has used. Even for tuberculosis, we can have something called as a video observed therapy. And in the technology part, it is not just that patient's compliance is assured, we also need something called as patient-generated health data. Patients seen today of an asthma or COPD, and now after 3 months, in between, what happened to the patient? Did the patient have an exacerbation? Did the peak flow monitoring show a dip in peak flow? We have just started rains in Mumbai. A lot of patients coming with exacerbations because of infections and non-infectious exacerbations. So what happened during those points? They may not come back to you. They may go to their general practitioner. They may go to, or maybe they are not in the hometown. They are outside somewhere. So patient-generated health data is something which will help you to know what has happened in between. And health data has multiple connotations. EMRs, we all know, and patient created data points gives us a longitudinal data, what happens to the patients in between visits. So in the future, all this data will be taken and it will be a key to practice and individualize the treatment that you want to offer. Currently, we have a specialist or a regular consultation. You teach the inhaler technique, or maybe you can have a teleconsultation. This is the linear mode of practice that we have. In future, it will be branching out. There can be a remote clinical monitoring. You also sometimes check the CT environment data. In fact, for patients in Delhi, patients in Mumbai for a long time, they used to move out by checking the AQI. What is the AQI today? Should I move out or no? During the COVID times, during the lockdown times, the AQI had improved drastically. So patients who went out felt better. So they knew what is the importance of CT environmental data. You can have an AI help in between patients' doctor visits. Your electronic records, if patient has got a record of the past by some other doctor, or your own record from the past, that might help. And e-learning of inhaler technique that will radically change our treatment profiles. So I would say the future of respiratory health management is not digital, it's not physical, it's digital, which probably all of us are using right now. The physical visits and the digital medium, whether it be teleconsultations or video explanatories, which we send out to patients. And we'll have to think of changing the orbits as a community. The next orbit is going to be data driven. Here, we'll have to not just rely on patient's memory, as Professor Paul Jones was saying, but also on the data provided by the patient. This will also make the practice and life easier for us pulmonologists, and we should enjoy this change. And here we have new partners like Pinktree who are helping us in the way ahead. So this is just a snapshot of what you can see. Imagine you have four type of patients and you can see, okay, you have one asthma patient today, you had COPD, you had probably a tuberculosis patient. What has happened? Has the patient taken inhalers properly? Has the patient not logged into the account and logged in their data today? If they have not logged in, what has happened? Has the patient got admitted? Has the patient got any other complication? You can get smiley reported just to say whether the patient is doing okay or not. And we can have vaccine analysis. When did you take the last vaccine? Most of the patients forget. Many of us doctors write it on paper, but sometimes patient may not take the vaccine with us. Patient may have taken the vaccine with some general practitioner or some other doctor or from some other hospital. So that thing patient can log in and you can come to know, okay, patient had taken a vaccine there. So maybe the patient needs a revision of a vaccine or maybe does not need. So all these things, and somehow if we can combine all these things into a single score, probably that might give us a snapshot of what is going wrong with the patient. So digital technologies can help us bridge the gaps, and patient platforms are the way ahead. Again, patient-generated health data is the key here. Patient has to make sure to log in and create the data, or maybe the healthcare provider at home can do that. And PGHD is gaining significant importance all over the world, and that is going to decide what kind of treatment you're going to offer and tailor the treatments. And there are platforms like Pinktree who aspire to be a leader in this PGHD. And remember that PGHD is going to help you and in the end the patient. The Pinktree has come up with something called as a lung score, which is a combination of all the data that you see. And this has been created by a biostatistician, and probably we'll get more and more data on this score. If we can validate it, probably that will simplify the life for us. This depends on the data generated by the patient or the relative, and obviously for us, we can also log in and check the patient score. Here we can see that if the lung score can also predict what is the likelihood of exacerbation for this patient or hospitalization based on the longitudinal data that we had, the how the patient has been taking their treatment, and what are the other comorbidities that the patient has. So digital platforms will contribute to better patient management and better disease management. And this also helps in education, reminders for proper medicine consumption. In fact, so much so the current app that I'm using for my OPD consultation, it automatically sends a reminder to a patient that you have a visit coming up next 2 days. It gets a WhatsApp message, patient automatically call and they say, okay, we forgot we have to come for a follow-up just because we got a message we came. And that was very good. Patients are happy. You have to inform them in advance that you're going to get a message, but those things help. And the data points that you create, that helps for better disease management. You get an information about the patient, you can actually remotely check. Sometimes we are worried this is a bad patient, might get admitted anytime, or there's a risk of death or hospitalization. You can passively check on the patient need not call you up and say, okay, how you're feeling. Sometimes you're worried about the patient, this thing helps. And it does not demand an extra investment time or anything from our side. The doctor just has to log in and check, okay, this is doing okay. Many of the hospitals have, like I practice in Jupiter. So Jupiter has an EMR. I can currently log in right now and check what are my ICU patients up to, what is the saturation, what is the um, settings on the ventilator which is going on, FiO2 we are giving. So those data points give me a um, peace of mind that I can sleep, this patient is doing better. So similarly, we can use this for the OPD patients. We get a health score for each patient every day on our phone, so we can add up to the long-term data. So, and I would say digital health tech is useful for every patient and doctor. Health data gets captured in the app voluntary and sometimes involuntary. You come to know by the patient visits. Gives patients more understanding. Sometimes patients feel, why am I not improving? Or why did I get an exacerbation? Maybe you're not taking your medicines regularly. Helps visit doctors at appropriate time. It can help patients build confidence and also enhance the doctor-patient relationship. Patients get more conscious about their lung health because we somehow pulmonologists tend to have a problem there. Patients are not scared of asthma. Patients are not scared of dropping out of COPD treatment or missing out couple of doses of antitubercular treatment. So patient starts taking the treatments very seriously. and doctors are aware about the patient's health and help prevent a future risk based on data-driven technology. So with that information, Dr. Prabhu Desai's talk, Professor Paul Jones' talk, and whatever I showed, let's do a polling. So we are welcoming you on the Pink Tree Fraternity page, and we'll now conduct a poll to understand which digital features of a platform are most useful to your practice. Just think about what all we have spoken up till now, what would help you. So how does the poll work? You go to the, if you can join from a laptop, it is better. Just go to the link section on the event console right below the speaker video. You can see the screenshot here. It is mentioned there will be link. Click on the link in the blue, which is the app. It will lead to another page. Enter your phone number. You'll be redirected to a different screen while the event is still on. And here you can log in with your phone number and poll on the question which is written. Once you have done the poll, come back to the screen where you are watching the program. I hope people are polling. All these things are going to help us in the future if we make sure that our patients are taking the help of digital platforms. In fact, patients sometimes, I mean, I tell my patients to think of it as a video game. Young patients find it very interesting. During the COVID pandemic 6-minute walk test, I had made a Google form, and I would tell the patient, okay, go ahead and fill up the Google form twice a day. So this will help. So you can go to the app and see the poll results. You can go right now also and poll right now also. So we know what is helpful for you. Think of it, tell the patient, think of it as you controlling your data, you controlling your improvement. You come to know whether you're getting better or not. I don't need to be telling you whether you're getting worse. The app itself will tell you you're getting worse. You have been not taking your medicines, your peak flu has altered, you missed your tablets, so what all can happen? These things do help. Thank you. Thank you, ma'am.
Mehul, will you be playing the video or that was it?
Mm, you want me to show the video? I'll just share the video. Yeah.
Yeah, it will be nice because I'm getting many messages from our viewers that can we have some formal show of what is being spoken about.
Yeah. So this is the video. I hope the video was good enough for explanation, but I think all of us, when we go on the app, we can see it's a very simple thing. And once we start exploring, we come to know the benefits of it.
Okay, thank you, Mehul, for this fantastic talk. You
Thank
know,
you.
I mean, I just feel that you are like 30 years ahead of me, and I'm extremely impressed that you're already using, most of the things which are there. Uh, I just personally feel that, in our practice, 98% of the patients that we see are normal patients. We don't really need to think too much. It's only 2% of the patients who we need to be super bright as compared to the others. So I feel that if 98% of the patients that we see are what any ABC can treat, then if we offer something more, then our patients will definitely want to come to us. So, because I think this concept is extremely good. If a patient knows that my doctor is tracking me, the patient knows that without having to say much, we will exactly understand how they are doing. I think this is genuinely a step forward. And I also feel that if we are into private practice, if we have our own center, this is going to definitely distinguish us from what others are doing. And it's going to make our patient feel extremely more comfortable and confident with us. So this was a fantastic talk. Thank you so much, Mehul, for the talk. And I even like the video very much, lively music and just so many things about it. And I think it's nice to send messages to patients. They would love it. If we say, look, you have an appointment 2 days later, they're going to feel so special. So now a huge big thank you to all our three fantastic speakers for the brilliant talks that they've given and for all the wonderful information that they've given. I'd like to now start the panel discussion, and we have 30, 40 questions from our delegates. I'll see how many we can take. So first, I'd like to ask Professor Paul Jones. So I'd like to ask you, if we are seeing really a difference in practice between India and UK, means I want to know that in UK, do you all utilize a lot of data of patients for disease management decisions? Can you unmute yourself, please?
Sadly, no. It's been a big challenge, for example, to get even hospital clinics to routinely get ACT scores and CAT scores in their patients when they turn up. In fact, in general practice, I think there has been much more adoption of patient-centered questionnaires like that than in hospitals. But in terms of what we've been talking about today, no, I think we have a very, very long way to go. We're not a role model.
Okay, fine. Makes us feel a little better. Anybody wants to join or add anything? Or should I move to another question? Okay, Dr. Prabhudev, I'll ask you a question if you want to add anything. So you wonderfully spoke about the compliance and the problems. So most of us doctors have the support system to help the patients. Like we do have the educator, we have the counselor, we have the nurses. But do you think that this is enough or do we need to do anything else?
No, I think that is 100% not enough. Otherwise, our country would have been patient would have been much more compliant in many things. So definitely there are a lot of gaps. The reason is that patient forget afterwards once they come to the clinic, and once you talk to them, 50% of them, 50% of them don't grasp. I'm telling you honestly, even how much they will be educated, because they at that particular time they are in the different frame of mind, and you are trying to educate the patient. So that's not the right time to actually educate. So a digital platform, yes, because they are at the home and they are very much away from the hospital environment or clinic environment, and lots of thoughts are there in their mind, lots of things, and they can individually get connected to you or ask you a question. Only thing is that Amita, ki how much time you are going to provide to your patient. So that's a challenge. So if suppose you have almost in India, every consultant is full of patients, and unless you are subspecialized in particular subject, then it is possible to reduce the patient, and then you can have much more one-to-one connection with your patient. But otherwise, if you are seeing COPD, ILD, and asthma, sleep apnea, lung malignancy, TB patient, it's impossible. So sometimes there are some digital platform needs, this is the beginning, but a lot of things will come in future where you will get connected to individual patient without getting stressed out and without your time being getting wasted. So there will be some platform will come, but this is a good beginning that our patient can be much more better, constantly educated. Okay. and that's number one. And there some small soft things can be discussed well on the digital platform. Obviously, as Dr. Mehul has very correctly said, their adherence, their visits will be better. They will not forget their visit, and obviously they will stick to the treatment what you have planned, you have done to the patient. So yes.
A wonderful answer, Dr. Abhay. I really liked one point that you said that in the hospital or in our clinic where we are advising, it's not a very patient-friendly environment to really, it's kind of intimidating. And you know, somebody else is waiting in the line to come in. So how
Correct.
much they really grasp. And if we don't tell, and if the nurse or the technician tells, they don't want to listen to them, unfortunately. And our patients take medicines while they are not good. The minute they are fine, they want to miss medicines. So very well said. You know, I think this is a wonderful app to begin with, at least to get familiarized with till we move on to even bigger stuff. So now coming to Mehul, Mehul, you used a very important word, PGHD, patient generated health data. So can you please tell us, because you know, honestly, at least I'm not using it and I'm not as smart as the younger generation is. So what could be the barriers to PGHD if you can tell us?
Ma'am, the first barrier is patient not realizing the importance of that. So a patient, I always give my patients an example of diabetes. They check their blood sugars, they have ways to check it, they have a blood pressure machine at home, and they say, okay, I am charting, I have a diary which is maintained. They come, patients who are discharged after COPD have probably a help at home, they nursing care or anything, then they have people helping them out with monitoring the patient data like they do at in the hospital. So I tell the patients, why not you manage your data? Problem is patients do not understand the importance. That is the first barrier they have. Secondly, they don't have a place to write it down. People still write it down in a book. BP at 3 p.m. was 120 by 80. I tell them to note down peak flow. They will write down peak flow was maybe 180 at 2 p.m. On 8th of April. Those things patient need a common place to put it. So that is the second barrier. And third barrier is lack of understanding. There are many patients who are not tech savvy. There are healthcare providers there at home, might be, but patients are not tech savvy. So these are three barriers that I face. You know, patients sometimes fail to understand the importance. They don't know where to put the data in, and they simply have a lack of understanding of technology.
Correct, correct, absolutely. Very well. So I just basically also feel that it's most important for the patients to themselves actually maintain their data, because they're going to rely on others. They may not find it that important. Coming to Professor Paul Jones, so doctors probably spend more time in UK with patients as compared to probably we spend in India. So on an average, how much time you spend per patient, and you think it impacts the results?
I'm sure it impacts the results. I do a lot of work in China, and the young doctors get about 4 minutes per patient, and the more senior ones get about 6. Yet they do really good disease management. I'm amazed, and I know you're somewhere in between. So it does impact the results. I think the big gain in terms of time is you've got more time to discuss with the patient and educate and get a better understanding on both sides of what's happening. I was thinking about this. What is going to change for us, I think, is our way of working. It won't be just a case of turning up in the clinic, turning on the computer to see the patient's electronic record, just like that. We will probably, I think, will be spending more time looking at what's happened to the patient and their integrated data. And that's going to require a change in our way of working. And the whole digital technology and innovation is going to change things more than just the way the data are presented to us, because we've got to have time to look at it and assimilate it. So there will be changes in the way we work as well as the way the data are captured.
Wonderful. That's great. Luckily, we do get more than 4 minutes and 6 minutes. So I think Indian patients are luckier than Chinese patients. But very well said. I totally agree with you. And I think it is really the next step forward if we want to improve our practice and what we offer to our patients. It's going to be beneficial to both us to take the correct decisions and for patients to benefit more from our treatment. So coming to Dr. Prabhu Desai, I basically feel that probably COVID was the time when we first became little digital, at least, whereby patients would be WhatsApping us their blood reports and the CT videos would be coming. And without examining the patients, we were actually taking decisions and they were following up also like that. So basically, do you think that post-COVID, there has been a difference in which we are seeing the patients and at the way, in the same time, like, are patients expecting anything different from us? Is there any difference in the way we were practicing or patients were asking us before COVID and now?
Yeah. Yes, actually, the COVID has taught us a lot of things, and COVID has developed this platform, Zoom platform. Actually, COVID has really all our lectures were on Zoom, and obviously now the patients practice also video-based practice. If you are doing web-based practice, we on those Zoom platform, and definitely the consultation, the for example, the just you have seen the patient and you are asked some investigation and you are written the treatment and patient goes and he has to follow up after 15 days. Why he should come from so far? So traffic is so much, you're so busy, so it's difficult for them to come and it's difficult for me also to accommodate them. So these are the patients where the consultation can be done really well. Follow-ups, especially like for example tuberculosis treatment follow-up, asthma COPD follow-up, ILD, whether the medicine is tolerated by the patient or if develop any complication. So this is one thing which we have really clear. But other thing is that seeing the patient's report, but I don't like that honestly, because when patient sends all the 10-15 different types of report to you, and it's very difficult to see it on the really the mobile phone, and if you want to compare that previous report what has really happened, then it's still more difficult. So there are some drawbacks of that also. And if your patient comes with the actually the reports with the paper reports, you can just screen in 2 minutes everything, you know what to see. So that doesn't happen in the, because you can miss the some important findings, important the numbers, especially when you're seeing on the digital platform. Second thing is that for pulmonary rehabilitation, I really, we can say that that web-based rehab program has picked up because of the COVID actually, and they are really equally effective like the in-person rehab program. And if you have a hybrid course with the in-person and the rehab together, web-based rehab together, it gives a fantastic booster program to the patient, and the follow-up and holding the patient becomes very easy with the web-based program. So there are definitely some advantages, disadvantages, but seeing a new patient on digital platform is not correct, I feel, because that clinical examination touch of the patient is lost. Okay, so I strongly don't see. I'm against seeing a patient first time on the digital platform.
Wonderfully said. Even I totally agree with you. If we've never seen the patient before, first time cannot be an online consultation. Ideally, we must examine the patient. And at the same time, as Dr. Prabhudesai rightly said, we have to actually tell our patients what reports to send us and what reports not to send. Because, for example, if we start AKT and 7 days later, if we have to just check the SGOT, SGPT, we can tell them just WhatsApp this report instead of coming. However, our patients often misuse, and if they have an appointment tomorrow, today evening you're going to send all reports to us and they're going to say please comment, please advise, please advise. So I think as it's going to be good, we also have to basically tell from before our patients what can be WhatsApped and what cannot be WhatsApp, so that we don't get really troubled. But of course COVID has changed the way we are practicing, and I just liked what Dr. Prabhudesai said. The physiotherapy and rehab has been amazing for the patients who are breathless, not having to travel, etc. So, Mehul, coming to you, all the techno questions I'm putting for you because I feel you must be most familiar with it. So, we know that patients do not like to key in data. They don't like to really put in their data. But if data is captured automatically and if it is interpreted by machine learning, then will that solve the problem?
To some extent, like if um, let's take an example of an inhaler with the number of doses pending and versus the inhaler which we used earlier with no dose indicator. So if it's 120 meter doses and patient is using 2 puffs twice, we would say, okay, you need to discard this after 30 days. Patient would sit and calculate. Sometimes patient would forget and just take just the propellant and not the inhaler medicine. Now with the dose counter, patient knows it's automatic. It's zero. I need to throw it away. So if there is an automatic data capture, patients will be most happy. We are lazy. Humans by nature are very lazy. But I still believe we can motivate patients to queue in some data, peak flow readings, maybe whether patients has any side effect, yes and no. Like if you have simplified questionnaires on the thing, maybe just sit on a Sunday and just recollect what happened during the week. That will be easier. But yes, if you have inhalers which can automatically sync to your app and deliver, if you have CPAP machines automatically generating reports, that will solve some of our problems.
Yeah, very well said. Actually, I just feel that CPAP data card is very good because it just, for us, it does everything and tells us. I also feel, if peak flow, we could have something whereby we are putting patients are doing peak flow morning and evening. And if at all there's a drop which is significant or significant reversibility comes in, and if automatically this data could be given to the patient, then I think it could be definitely used more effectively by patients by doubling the dose of the medications, etc. So thank you, Mehul. Yes, yes, please add.
Can I just a little anecdote about that? We've just done a study in Japan looking at electronic data capture on a daily diary and weekly CAT. And this is in Japan, very good compliant patients. After 6 months, the compliance for both the daily and the weekly data capture dropped off a lot. But it was much more for the dailies than the weekly. So I think we've got to be reasonable about the data we capture, because otherwise, if it's too often, the patients will just give up very quickly. But maybe weekly, or possibly depends on monthly, using reminders. And that's one of the advantages of digital techniques. You can remind the patient to do it. I think we've got to understand it from a patient's perspective as well as ours.
Wonderful. I think this was very, very useful tip because I feel that initially we're excited, but as time passes, people get tired of everything. And therefore, maybe initial monitoring could be more often, and then we space out as patients are doing well. So coming again to Dr. Paul Jones, if you can tell me, probably in the Western world, the home devices are being far used too much as compared to in our country. So is it helping outcomes? Because, for example, I know that patients actually have home spirometers and they do spirometry much more often than we do in our country, once in 3 months on paper. So does it really help outcomes, improve outcomes?
As Mehul said, we are all lazy and patients are the same across the world. And you can give them devices and they won't record it. There's got to be something in it for them to do it. So as I said at the outset, I don't think we are offering any role models for anybody else to copy. I think patients are the same everywhere. So we have got to find a compromise between what we would like ideally and what they are prepared to do. Getting 2 weeks worth of peak flow recordings in an asthmatic is sometimes a challenge. And you say, I only want 2 weeks worth, but even then that's difficult. So I don't think at the moment anyone anywhere has cracked this issue. And that's the problem for us, because you can put a glucose monitor, stick that on the arm. People will record their blood pressures more regularly, but actually a lot of our outcomes are very patient dependent. And I think that's more of a challenge for us than for some other disciplines.
Yeah, very well said. Yes, please add, Mehul. Yes.
Yeah, so Prof, I used to do something, I don't know whether it'll work for all patients, but during COVID times, I would tell the patients to put a reminder on their mobile, 8 a.m., 8 p.m., to do a 6-minute walk test. And I would give them a Google form and they will just put the saturation before and after, the pulse before and after, just basic stuff. Yes, that was a challenge for many patients, but that did improve. If you get mobile reminders, if you have actively put a reminder, I think some patients will follow.
Yeah, no, I agree completely. I think they do value reminders and do respond to them. I think that's probably the best solution.
I believe the trick is, to make the process very exciting. So, I just kind of feel that if we can get the way of putting in data or looking at it, if there's some kind of fun, you put it up with a game or you engage somebody else, a younger person from the family, and make them feel important. I think that might just help. But yes, we need to keep them continuously interested. Otherwise, the result and the performance will keep on going down. So coming to Dr. Prabhu Desai, is there a specific sequencing of the treatment process to improve patients' compliance to therapy? Like, for example, training on inhaler usage, then checking again, etc. Any specific sequencing might improve compliance and sticking to the digital world?
Um, See, for example, as well as inhaler devices are concerned, okay, how we can make it more compliant, but is basically the you can say that we can have a QR scores for the all different types of, because so many inhalers are there, so patients and so many types of inhalers are available in India. It's not that one particular thing. So we need that if the whatever we need a something like a QR scores for each particular inhaler device, and that patient actually just screens that and he sees how it can be used best. Okay, so and then if he's not getting all right, we can always ask them to go and check it whether you are using correctly, or when they come back again, if they have questions, we can always improve their inhaler technique. But their enthusiasm will increase if you give them a lot of things to feed, and so that they will constantly be in touch with the good health practices, so that it's maybe inhaler device, or maybe to find out the how to improve the air quality around them, or how the exacerbations they can pick up very early before, and they can consult the doctors early, so with this sort of practices, which I feel.
Yeah, definitely. I think very well said. And I think if the device is going to say, look, you're not doing well, go to your doctor or something like that, then the patients will also feel more enthusiastic about using it because they know that it's actually translating into better clinical care. So very well said. Mehul, coming to you, is there any specific data point that is super important for you to take any patient health decisions, from all the digital information that you get?
Now, it depends on what disease we are looking at. If it's a sleep apnea patient, I would want to see whether they are using the CPAP correctly. If there's an asthma patient, I would want to know whether they're taking the inhalers correctly. So basically, the inhaler technique, I might want to know the peak flow of the patient. If it's a tuberculosis patient, I would want to know whether the drugs are consumed daily. Are there any side effects patient is logging in? Okay, I got nausea today, or I maybe I've skipped my doses or something of that sort. So the regularity of medicine, the compliance for asthma, it can be a peak flow monitoring. For sleep apnea, the use of CPAP, and whether they face any issue. Most of the times patients have small complaints which they find it difficult to reach to us. So maybe a symptom chart they can maintain. I had dryness today, I had nausea today. All those things might help me understand how the patient is doing, whether the patient is getting better or patient has a possibility of worsening.
Okay, fine. So very disease specific, correct. I think so basically based on what our patient has, we have to tell them these are the important points. And if
Yeah.
anything, then do reach out to us. Okay, very well said. Uh, Professor, coming to you. You spoke about this fantastic Lancet article. So first a request to just repeat about the article for the benefit of those people who might have logged in a little late. And we are seeing these articles like the Lancet articles that you mentioned. So is this more theory than practice?
Yes, it's a good question. For years I've been talking to digital people, and they've always young, bright-eyed, got wonderful ideas, and I've learned not to sort of discourage them because their ideas are really important. And I think articles like that, blue skies thinking, very enthusiastic, are important because they set a goal. Say this is where we might be able to go, and show us the direction that we could go in. I think some of them are unrealistic, some of them are impractical, but without those new ideas, we won't move forward. So I think they are very important. But in terms of practical science, practical or clinical practice, there is sometimes a big gap between the wonderful vision for the future and where we are now. But if we don't have those wonderful visions, we will never get there. So I think they are very useful.
Wonderfully said. Wonderfully said. Though there's no ideal world, we always have to thrive for one. And these fantastic ideas are going to actually make a difference. Very well said. I really like the answer. Coming again to Dr. Prabhadesai. So, does peripheral issues of management like air quality monitoring, allergen definition, and control, are these a reality? Is the therapy going to get personalized? What do you feel?
Yes, may not be to all patients, okay, but there are certain patients, like for example, people who have get very severe allergies or anaphylactic reactions, okay. So you will be in the really speaking in touch with them very much better way, much better, and it will be a personalized medicines, personalized practice to them who need it actually. So you have to select your patient where these are the patients who are, say, for example, a drug toxicity because of the anti-TB drug, okay, like rash happening because of one of the drug, and you have to find out the drug. These are all things can be personalized, okay, and you can be. So there are many in every disease there are some issues. Like you take a sleep apnea also. Not all sleep apnea patient requires very close monitoring, but there are certain patients who are on the very high CPAP pressure or are using BiPAP. We don't know what exactly is happening to them. And so these are the patients or patients with narcolepsy or patient with excessive hypersomnolalism and obesity overlap syndrome, all those patients, or even in just like I discussed in TB or in some patient in ILD. Okay, of course, allergy, asthma, and anaphylactic reaction. So all those patients, few patients you are having a special interest, you can give them extremely good management and care.
Yeah, very well said. So not everybody requires everything, but those specific patients, it could be really life-changing.
And even suppose just would like, I think there will be like in country UK is completely different compared to India. And if we see that in here every consultant Amita must be seeing almost 30-35 patients at a time in OPD. So it is very difficult. So there will be a new people will be generated. I feel like healthcare secretary, we have only secretaries. So
Correct.
now there will be healthcare secretaries. So they will be little more educated about the healthcare and lot of other technology, or they may be also educated about the disease which are generally the consultant is managing. So obviously this is a new entity will probably generate and who will take care of a lot of the patient related issues, and you will be connected with the patient through the health secretary. I think that
Very
can.
well said. No, very well said. I think this is a huge, there is really, it could be a subspecialty in
Yeah,
which people
it's
only
a
make
new
sure that the
jobs will be created. Okay,
data
because the
is
digital platform is going to create money also to the doctors and to the.
doctors.
So obviously, some of the money will go to these healthcare secretaries, which can really new people will be our new branch will come.
Absolutely. And before the patient comes to us, they could analyze the data and quickly update us.
Yes.
And so I think it's fantastic, superb. Uh, Mehul, coming to you, I want to ask you something which is, I think, quite exciting. So, as a doctor, does the remote monitoring of your patient make you feel more secure in our country and more in control? And can you tell us any real life experience in which the digital monitoring of the patient, like you said, the physical with digital, in any of your patient, has it really made a difference to your decision? Can you tell us your story, how this helped you?
Ma'am, I feel the second part of the question, the phygital part, I think all of us have done. Prabhu Desai sir was talking about people sending you reports on WhatsApp or maybe by email. You see probably the liver functions have deranged after giving an anti-TB treatment. Straightforward, you call the patient back and you tell them, okay, maybe treatment needs to be changed. If patient stays far away, you can always tell them on a video consult that stop the treatment for 3 4 days, take this treatment, visit a gastroenterologist. So this is something which was very commonly done. And while we are having this, I just got an email from a patient about the CPAP settings. I mean, patient has used the CPAP for a couple of weeks now and has sent me the data. I've not gone through it, but that is how the phygital medium helps us. I mean, we have to accept that this is going to be the future. Now, as far as being in control, it's not for all patients, ma'am, but we need to have, and there are at-risk patients, patients who have, very severe COPD, or probably who stay very far away from us, and we are not sure about their compliance. There, yes, if they log in data, I'll be very much secure, and I'll feel that patients are doing okay. I know, I have an aunt who's a severe COPD patient, oxygen and BiPAP dependent. So I know she just sends me a message every week on Sunday morning, I'm doing okay. So that data is also enough for me to know that she is doing okay. So that much information we do need. That makes us secure, and the apps can help us do that. And Prabhudesai sir spoke about health secretaries. I think these apps are intending to do that only, sir, for us. They are trying to be our health secretaries, where they give us some data. Yes, as doctors, we have to analyze the data. Once we read a chest X-ray, we see reports sometimes written bronchitis, but we need to find out whether that is actually bronchitis or not. So that is just an AI helping you to some extent, and then we have to use our brains enough for it to interpret it.
Right. Okay, wonderful. So yes, maybe unknowingly, all of us are using a little bit of digital health, and I think it's extremely, extremely important. So now coming to Professor Paul again, how do we embrace the change with digital platforms like Pinktree? Like we saw the video, so how would it help us change our practice?
Yeah, I think I'd reiterate something that both have just said. This isn't necessary for everybody. And I think, when doctors get a new treatment, they'll tend to use it in their most severe patients, which is probably the wrong way round, because the most severe patients are usually the least responsive to everything. So you end up thinking, well, it's not much of an advance. And I think it's a similar thing with digital technology. We will, as we use it more, we will learn who it works in best and who is just not worth trying in. So it's finding the appropriate patient. And I think it's a different type of patient personality. Coming back to a point that was said earlier, that about making it fun, but also actually getting the patient to understand that it's actually valuable for them and not valuable for us. This is going to make a difference to them. Our life will go on, whatever they do, but it can make a difference for them. And finding out the patients for whom this will work, I think, is going to be a big step forward. We will only do that by trying it in a different range of patients. I suspect in putting it into our least compliant patients, our most troublesome patients, is not going to give us the best impression. We have to find a sort of a happy medium there. But I think that's like all new treatments, management tools. We learn in whom to use them best and who they're most appropriate for.
Yeah, very well said. I totally agree with you. Thank you. Okay, Dr. Prabhudesai, coming to you. How can data interoperability improve the efficiency of healthcare systems?
I think you can take very early correct decisions. It's very important. I think that's much faster rather than you can change your line of therapy if it's really requires, and just by the data which you get, which is very immediate and stat data. So I think definitely you can pick up the problems, we can diagnose them, you can correct them very fast, and this will definitely change our uh, treatment methodology, especially in some selected patients.
Yes, again, very well said. Because I just feel that, for example, like Dr. Mehul said, the inhalers with a dose counter, it has really made a tremendous difference. So I just feel that as we keep on working on these apps, we might just find the eureka point which might seriously translate into better patient care. And like Dr. Prabhu Desai said, that definitely it's going to improve the outcomes by diagnosing the problem much earlier, before the patients also feel it. So I think it's going to be very, very useful. Um, Again, Dr. Prabhu Desai, asking you only, how can we ensure patient confidentiality on such a platform and assure that there's no data breach? Since this is one of the important points which patient would be really worried about, taking up an app or wanting to fill in the data. So does Pinktree has data privacy? Because you've used it a little bit, so
I think there's definitely it's a data privacy. There's no doubt about it, and that is the most important aspect. In fact, there should not be any breach in this aspect of whatever the platform you use. Okay, so data privacy is very important, and the patient's confidence is so important. So it has to be it is there and it should be there.
correct, absolutely. A very important point that this is maintained. Correct. So, Mehul, coming to you because you've used Pinktree, is Pinktree chargeable? And if yes, what are the costs?
I think it's free for us as healthcare providers, but I'm sure developing and making an app does require a lot of capital. So I'm sure they will charge the patients. I think it's around $1,000 a year, which should not be much for a patient, provided a patient is getting a lot of data from there. They download a lot of apps with nonsense. This is actually related to their health. So I'm sure patients will benefit. For us, it's free. For doctors, it's free.
Yes. So, for doctors, it's free. And even for patients, it's actually 100-day use is free. And after that, if they want to continue using it, then they charge 999 rupees a
Yeah,
year.
trial basis, it's free. Yeah.
Trial basis and all. So it's quite good. So, so I think, okay, coming to Professor Paul. So what does Pinktree offer doctors as far as treatment care or whatever kind of gratitude they want to really feel, etc.? Is it a neutral platform? What is it?
That's a very interesting question. I've been involved with Nandita and Pinktree for over a year, I think, Nandita. And I've watched it develop and evolve. It's actually much more sophisticated than the first versions that we worked on developing the content. And so I think it's now released for general use, but I'm sure there will be a lot of feedback from users, both HCPs and patients. And I think it will evolve more, perhaps it's already patient friendly, but maybe in a more patient friendly approach, maybe cutting down some of the material and enhancing some of the others. So I'm sure this is just the first iteration and we will watch it evolve. And of course, that's it can only evolve with feedback from users. So I think that's going to be a very important thing for Pinktree to capture.
Yeah, very well said. I think it's our feedback which will help them improvise. And I'm sure our feedback would be very important to them. So Mehul, what is this Pinktree fraternity? What is it all about?
I mean, it's like a community. Like we have a lot of WhatsApp groups, we have WhatsApp communities. So it's like a Pinktree fraternity where it's basically for chest physicians who can come together and share their thoughts. They can have interactive polls. Um, Suddenly, all those communication apps have got a lot of noise in them. The Facebook, the WhatsApps, the Instagrams. This becomes a little more dedicated. So if you want to have a genuine discussion, we know that this is where we go. There are discussions, as we all know, we are all part of so many communities on WhatsApp, but a lot of noise happens there, which is not related to our fraternity. So this is something which will help chest physicians connect with each other and grow together.
Okay, very well said. So are we excited about this Pinktree app in our practice?
Um, let's hope so, ma'am. Let's see what else. As I said, as Prof says, okay, we have to see how it develops, and every time we give feedback, probably things will change, and we'll find out what sticks and what doesn't stick.
Right, absolutely. So we have many, many audience questions. So I'll just take the questions that we've not already taken. So coming to Professor Paul, so we have Dr. Sanket who's asking, how can digital technologies be used to improve lung health in low resource settings and reduce health disparities?
Now that last bit's very interesting, isn't it? Because health disparities are related to socioeconomic status and socioeconomic status tends to be related to use of apps like this as well, I suspect. So it just occurred to me that the groups who may benefit from it most are perhaps the groups who will not immediately have access to it or won't immediately see the value of it. So I think that's going to be actually getting those groups involved is going to require active effort on the part of physicians to encourage this use, because maybe that group who are less educated may not see the value in it. Although, India is the most digitally literate, or second only, I think, to China in terms of digital literacy. But I think access is going to be important, but it's not just a question of financial access. If you like, it's more social and attitudinal. But I think what it can do, we have our, I COPD specialist. My patients are, low socioeconomic status, or usually are lower education level, and have it often more difficulty and describing in a very clear way what their problems are. I think the structured approach in apps like this can actually do what we attempted to do when we developed a CAT, improve doctor-patient communication. So I think this structured way of communicating, getting key information from the patient may actually help in this process of communication between physician and patient.
Yes, very well said. Coming to Dr. Prabhudesa, we have a question from Dr. Bhavyaja. She's asking, what role can wearable devices and mobile apps play in monitoring lung health and detecting early signs of disease?
I think we just discussed this in depth, actually.
Yes. So basically, we can identify a problem early and treat the patient much earlier. Yes. Actually, there are just too many questions. I'm just getting lost. Mehul, coming to you. What are the opportunities and challenges of using social media and online platforms for lung health awareness and patient support? So, challenges and opportunities.
Opportunities are tremendous. We see a lot of non-specialist or so-called alternative therapy specialists who come and give their guidance. I think we as pulmonologists who have actually the holistic information about the disease, we can come up on social media, and there's a lot of opportunity to discuss what are the important points, what are the myths. Challenges, the problem is it can be taken out of context. When you speak about a certain disease, it can be taken out of context. When you are answering, do a Q&A session, I do sometimes on social media, it can be taken out of context. And patients tend to reach you out there where you may not be active 24 hours. So there becomes a communication gap. They have, like, ma'am, you have WhatsApp numbers. Patients tend to reach you on it's a social media platform, and you may not be able to reply to them on time, and that might be a challenge, and they might feel offended, or they might keep on calling you up or whatever. So that becomes a challenge.
Yes, very well said. Yeah. There's a very interesting question about artificial intelligence. So let me ask Professor Paul about this. So Dr. Rida is asking, how can artificial intelligence be used to develop personalized medicine approaches for lung diseases and for the treatment?
Yeah, I could talk at great length about this, because it's become, the term artificial intelligence has become very popular, and it's used for different purposes. But in this context, I think it's most useful at identifying patterns and associations. Now, we've had plenty of tools, scientific and statistical tools for identifying those patterns in the past. I think where AI ML may, at an individual patient level, may be useful is that it can assimilate a lot of data quickly, and if you've got the algorithms right, perhaps summarize and give advice. But that is always going to be advice. Like in my example about the asthma patient whose control got worse, and you see them and their control's better, do you step up their maintenance dose of ICS? So I think AI may be useful, or almost certainly can be useful for giving options to the clinician. But as Mehul said, you got to use your own judgment when that's what the doctor's there to bring all that information together and then make a judgment. So I think AI ML may be able to summarize and put together options that you can draw on when making a clinical decision.
Okay, wonderful. Very well said. Dr. Prabhu, they said there's a question for you. Dr. Sonal is asking that if she wants to download the Pink app, Pink Tree app, then how does she do it?
I think you both your even in the your what do you call it?
Yeah, I think we can maybe play the video again and they'll get the details in
Yeah,
it.
I think
It's
even
available on both the platforms.
both the platform actually, Google
Right.
as well as
It's available. Yeah.
Right. Okay. Again, there's a question for you, Mehul, specifically for you for artificial intelligence and digital platforms. So, what are ethical and regulatory considerations surrounding the use of AI and digital platforms for lung disease diagnosis and treatment? Ethical considerations and regulatory considerations.
Ethical, I think sir spoke about data privacy. There is a problem, and it should not be shared even when we discuss a particular case even in a conference, or where we are supposed to remove the patient name, label, and all. So that is one thing. And how much the platform that is using the data is going to kind of get, how do I put it? Is the platform going to use it for something else? Is it going to use it only for the development of the app? That is the ethical consideration that comes. Regulatory, I think currently video consultations are allowed, and uh, remote monitoring is something which government also is promoting. So I don't think there should be any regulatory issue there. I think AI is a different thing, but these two things I think should be okay. And artificial intelligence trains on the data that you give. So I
Correct.
don't there is any ethical dilemma there, but the app developer has to be a little more ethical and use it only for the development of the app.
Okay, great. So we still have about 22 questions, but I've just gone through them and we've answered basically most of it. So I think I won't take the questions again because in detail, all the three speakers have given us fantastic information. I'm myself extremely excited because the thing is that a lot of digital health which I was using, I wasn't knowing that I was using the digital health. And now I know that there is something more and better that I could do, which is not very difficult. And I basically feel that it's only going to translate into better patient care. And therefore, it's quite exciting because I think we'll end up offering much more than our peers are going to be offering. And therefore, our patients also will be more grateful to us. I just thought, should we just play the video once again for the familiarity of everybody? Because we've got 2-3 messages saying, can we please have the video again? They want the details. So can you
Okay.
please play the video once again?
I think they can only play. Yeah,
Yeah, tech team, if we could have the video, please.
video, please.
I have a very big smile on my face because I'm just so excited the way it is showing what a difference it can actually make, whether it's COPD, asthma, obstructive sleep apnea, or TB. 85% of our practice. I think it just sounds extremely promising. I'm extremely keen to start using this, and I just feel that after some time, even my assistants or my nurse, etc., can start going through it, pretend to be me, go through the data, and then inform me from time to time if anything important comes up. But I think times are changing. I just feel that it's very, very important that we incorporate digital health in our practice, because we'll end up offering much more, and we'll make sure that the future of our patients' health is much more secure with us. I'm so grateful to all my three brilliant speakers. Professor Paul Jones, thank you so much. I know it's late, and you are giving it's like 2 hours you've been logged in with us. And thank you so very much. We are thrilled to be online with a great achiever, a KOL like you. And thank you so much for being on board and giving us all the important information. Dr. Prabhu Desai, thank you so much. Every time I get to interact with you, I feel blessed that, I have a dear friend who's a senior who I can always count on, who's wonderful and is always so updated in his care, always available to share knowledge, to share new things with us. And you've given fantastic information to us. And Mehul, I feel extremely proud every time I look at you. I got messages, Mehul is talking very well, and it makes me feel just so proud that, we see you climbing up and, touching more horizons every single day.
Right.
So, a huge big thank you to all my brilliant speakers who I've learned so much from. And a big thank you to the entire Governing Council of Indian Chess Society for taking up this wonderful initiative to inform all our audience about this fantastic app, the Pink Tree app, which is going to really make a difference to our lung care. And I would also want to thank the two lovely girls. I want to thank Nandita Dandekar and also Dr. Mrunmayee Toraskar. The two girls have developed this app, and therefore I feel extremely proud because I'm just so technologically challenged. And when I see girls doing so well, I feel wonderful. A huge big thank you. We've had 1,672 logins today, and we had like 32 questions. And I think we've done really well. So I would like to just ask the last question to all the three faculties, the same question. How do you see the future of respiratory medicine change with the digital health coming in? Or what are your comments about today's webinar? Starting with Professor Paul Jones.
That's always a difficult question, isn't it, to predict the future? I think if you read these articles that this is going to revolutionize things, but revolutions rarely come. They come as incremental change. And I think this is a significant step forward. It won't change everything for every patient, but for some patients, I think it will make a very significant difference.
Wonderfully said. Dr. Prabhu Desai?
Yes, it will change our practice, no question about it. I strongly feel ki probably because of this digital platform, we are so going to be close to our patient that especially if your specialty interest, if you have a particular branch of respiratory medicine, maybe airway disease, maybe diffuse lung disease, and there will be this is what I feel. We will be more subspecialized because of the very closeness to our patient and much more data which we are going to get, and probably our research as well as the our patient care will improve.
Wonderful. Mehul, what do you have to say?
I think everything has been said. I just strongly feel we should embrace technology, and we will modify it as we grow along. I mean, we'll realize something which is working, something which is not working, and something which needs to be added. I mean, as I said, ma'am, I did develop my own software, so I realized that this is needed, that is needed. Somewhere down the line, you realize what is needed, what works, what is possible. And AI has made, I mean, it's a big ocean out there. We can just pick and choose what we want for our practice. It will work out. But only for a limited number of patients, we can't apply it to everyone. That is one thing which all of us agree on.
Wonderfully said. So I think digital health is something which is definitely going to help, if not to everybody, definitely to quite a few. And I think this is the way forward. I'd like to thank my three speakers all over again for giving us fantastic knowledge, for enlightening us, for giving incredible inputs, which is definitely going to change our practice, and it's going to change our outlook towards the way we would like to practice respiratory medicine. Thank you so much. I think we've been going on for 2 full hours, and we still have 1,672 logins. I'm sure we've exchanged a lot of important information, and I look forward to a great feedback from all our delegates. A huge big thank you, all three of y'all, Dr. Prabhu Desai, Professor Paul Jones, and Mehul. I really enjoyed the webinar. Thank you very much.
Thank you,
And
Nandita.
good night.
Thank you. Thank you. Bye-bye.
Good night.
Good night.
Bye. Good night.